Welcome back. As we age, our eyes change. We start needing reading glasses and more light, but if your vision starts to turn cloudy or blurry, or you struggle to see at night, it may be time to take some action. And joining us now to talk about a customized approach to cataract surgery is Dr. Nicholas Bruns and Dr. John Vukic from Summit Eye Care of Wisconsin. Great to see both of you again. It's wonderful to have you here. So just give us a baseline here. What are cataracts?
Cataracts are, well, let me take a step back. Everybody has a lens in their eye. It's a clear lens, and that's what's responsible for focusing light onto your retina. Think about like a movie theater. Your retina is like the movie screen. The lens is kind of like your projector.
Okay.
So it's when the lens becomes cloudy and it impedes the amount of light or the quality of light that gets to your retina. So cataracts are inevitable. It's a rite of passage. You live long enough, you get the gray hair, you get the wrinkles, you get the cataracts. That's what happens.
Yeah, it comes with that wonderful aging. So how do you diagnose cataracts then?
It's based on symptoms. So we can see it. So just like the patient has cloudy vision, when we look at the slit lamp during an eye exam, we can see that the lens is no longer clear, that there is some discoloration or that there's some irregularities that we know are creating the problem that the patient is observing.
Okay, so is it fairly easy to diagnose with the right equipment,
Absolutely,
would you say?
yes.
Oh, yeah.
Okay.
Yep.
So in terms of the way that they've been treated, because we've been teasing, it's not your grandmother's cataract
Not at
surgery.
all,
And I
not
remember
at
my
all.
great-grandmother having cataract surgery. How has it changed? How is it done traditionally?
It's changed on several ways, right? So the way we used to do it 40, 50 years ago, it used to be an overnight stay in the hospital. It used to take a long time. It was a pretty invasive procedure that had some recovery to it. Nowadays, I mean, you do cataract surgery in 10 minutes, right? Pretty quick. It's
Amazing.
I tell people all the time, I'd rather go through cataract surgery than go to the dentist.
Yeah.
So especially in the last 10 years, and no shot at a dentist there,
Right, I
but
get it.
cataract surgery is pretty basic.
Yeah.
So the way we used to do it, especially in the last 10 years, we used to take all of these numbers, all of our preoperative measurements, and we used to take them and kind of analyze and try to get a best fit. You know, it's basically a small, medium, or large, and we try to get as close to your outcome that you wanted. Now we can be much more custom. So we're not necessarily trying to get it close, we're trying to nail it and try to get the exact outcome that you're looking for.
Amazing.
Customized.
So there's been a real evolution. It was clear the vision, then it is correct the vision, and then it is correct the refractive error. So if you wore thick glasses in the past, maybe all of your life, or you require glasses for certain tasks, we can now incorporate that into the correction of the surgery itself so that you have very natural vision. And that's considered a premium upgrade. Medicare and the insurance companies will cover the basic surgery, but people who want a little bit more, people who want to say, I want natural vision like I enjoyed perhaps in my youth, we can do that, and there are implants specifically designed that give that capability.
Amazing. Dr. Mangione, who's a regular guest on the show, had, I think, that premium upgrade that you're talking about. She's so happy with her results.
Yeah, she had one of them. Yeah, the light adjustable lens, which you just saw on the screen there.
Yeah.
It's the ability to customize things, and it fit her lifestyle. She didn't want to wear glasses. Some people do, and that's fine,
Yeah.
but others want to get out of them or at least reduce your dependency on them. That's the options that we have.
And what type of outcomes are you seeing with the customized cataract surgeries?
Well, the idea, of course, is to provide what the patient is looking for. And so some individuals really want perfect distance vision, and we can do that. We can adjust and achieve that vision. But importantly, they have the ability, especially with the light adjustable lens, to try the vision out. You don't have to say what you want, you can tell us what you like, because we can adjust and say, all right, go out and live with it for a week and tell us, would you like a little bit more reading? Would you like a little bit better distance? And we can adjust so that we get it just right.
It's unbelievable.
Yeah.
I mean, how far things have come with correcting people's vision, and to go from, for me, for example, I have to use reading glasses all the time, and to think that you wouldn't have to wear them is incredible.
Vision is so subjective. You know, it's tough to say, you know, why would an airplane pilot, you know, want the same exact procedure as somebody who knits for a living?
Yeah.
Very different aspect, very different subjective needs and different lifestyles. And so we can now match exactly what you need to your lifestyle, your occupation, whatever you would want.
Incredible too that the adjustments can be made after the surgery is performed. That's what I can't get over.
Yeah, so the variable is the healing process. We like to think we have a good idea of how the eye is going to heal, but it's a biological organ. It's got a mind of its own. Things kind of, you know, change over time.
Yeah.
We can let that process happen, and then we can make a change.
And so the adjustments, just to be clear, it's done with light. It is not done with more surgery. It is done with a special wavelength of light that the implant responds to. And we can take the refraction that would normally be used to make glasses or prescribe a contact lens. We can program that into a very high-tech deformable mirror shine a wavelength of light onto the implant and make glasses on the implant. It's remarkable technology.
Incredible. Yeah, I'm glad that you clarified that too, that it's light and not
surgery,
further
yeah.
surgery. It sounds like there are lots of different concerns that you can address with these different customizable surgeries.
Yeah, oh, totally. I mean, so the big one that I always get is astigmatism. We always are worried about that big word, that astigmatism word. Yes, we can do astigmatism. That's not a concern. Or the needing of reading glasses. That's not a concern too. It's likely you'll need reading glasses for small print. That's likely. I mean, those are the laws of physics that kind of dictate that you probably need some help up close. But reducing dependency, we can definitely do that, and we can make your distance as good as you need it to be.
And recovery must be really quick.
The recovery, people will see better right afterwards, but it's during the adjustments, and typically we do that at about 2 weeks after the surgery itself, and that's when the magic happens. That's when we've had patients literally call us from the car as they're driving home crying, saying,
Yeah.
this was amazing.
I love what you guys are all about. You have such a wonderful practice. Thank you so much for joining us
Thanks
here
for
today.
having us again.
That upgrade might be a nice holiday gift for
Uh-huh.
someone.
It's a gift you can give yourself.
Yeah, absolutely.